And now it's my pleasure to introduce to lead off our show tonight, Doctors Vivek Murthy, who is the United States Surgeon General, and Dr. Lena Nguyen, who is has almost become a member of all of our families, as we've listened to her on CNN and many other outlets, as she's been giving freely of some of the best and most useful advice that we could possibly have. So I'm glad to have both of you joining us for this conversation tonight. And let me also indicate that we're particularly pleased that you're both here because both of you are parents of young children, and that is exactly what we're here to talk about tonight. To begin, Surgeon General Murthy, let's set the stage a bit and just give us a little picture quickly of where we are with our current picture of where America is with our experience with this pandemic at this moment.
Well, thanks, Reed. It is so good to see you, and it's so nice to be here with my dear friend, Dr. Nguyen, as well. So glad to be having this conversation. We are actually at a much, much better place now with the pandemic than we really have been at any point this year. We've seen cases come down, and they're continuing to come down. We're at our lowest point in probably close to a year in terms of new cases. We're seeing deaths also come down in hospitalizations, which is wonderful news. And if you look at particular populations, particularly seniors, what you see is that deaths have dropped 80% in seniors, where we have at least 85% of our senior population with at least one shot. So this is really, really, good news. And part of that has resulted from the fact that we've had a successful vaccination campaign to date, where we have now 50% of the US population fully vaccinated. We've got a lot more of a way to go because millions of people are still not vaccinated, and those include children who we're here to talk about today. But we now have a vaccine for adolescents, ages 12 and up, which is a big deal. We have trials underway in younger children, and maybe over the next few months, later in the year, we may get some news about those studies, and hopefully by the end of the year, something will be available for younger kids. So all in all, if you compare where we are now to this time last year, we have made a great deal of progress. I think thousands of lives have been saved because of these vaccines and because of the great public education work that's being done by doctors and nurses and people like Dr. Nguyen and others all across this country. We're helping get accurate information to people, connect them to the right resources, and help them protect themselves and their families.
Great. And just a couple of quick seconds on how concerned are you about the variants and what does that really sort of portend for the future of this pandemic?
Well, I am concerned about variants. The good news so far is that the vaccines that we have available here in the United States are still effective against the variants that are circulating in the United States. But my concern is that that may not always be the case down the line if we have new variants that develop. They could potentially escape the protection of our vaccines. And that's why it's so important that we not only get a handle on infections here and reduce the rate of infections in the United States, but that we are also good partners with the rest of the world and help to reduce infections around the world. Because if cases are out of control in India or in Brazil, as they are now, or in other parts of the world, that means variants may develop there. And those variants will inevitably end up here in the United States. So this is a global pandemic. It requires global cooperation, mutual aid, and we've got to see that as part of our duty to end this pandemic.
Well, thank you. Well, now getting to the issue of our children, one of the issues that we have to confront is how parents are going to be able to make an appropriate risk assessment. And so I'll start again with you, Dr. Murthy, and then I'll turn to Dr. Nguyen. When you think about making a risk assessment of whether or not to have our children vaccinated or not versus the seriousness of the disease, how do you think about that as not only in your job as Surgeon General, but also in your role as parent?
Well, it's a good question, Reed, and I suspect this is the same for Dr. Nguyen and I. We have many hats that we wear, but first and foremost, we're parents. And we think about this from the standpoint of our children and what would we do for the people that we love most in life, our kids. And so what I can tell you, that when I think about the vaccine and kids, here are a couple of things that go through my mind. And let's talk about adolescents for the moment, because that's where we have a vaccine available. So number one, it is true, certainly, that adolescents are at lower risk for bad outcomes with COVID. It's absolutely the case, thankfully. But what we also know is that we've had millions of kids infected during this past year and change with COVID. We've had more than 15,000 kids who have been hospitalized. We've lost nearly 300 children. And we've had thousands of kids who have also developed a multi-system inflammatory syndrome related to COVID. And so this is not a benign disease. It's not one that comes without complications. The other thing to keep in mind is that what the vaccine really will enable our kids to do beyond protecting them from illness is it breaks the chain of transmission in a sense. Our children, even if they're not sick, they can unintentionally carry the infection to other people. The more people who are vaccinated, including kids, the fewer places the virus has to hide. And that means that more people in our community will be protected. And then finally, this is what comes to my mind as well, is to think about what our children will have access to once they get vaccinated. We know that when our kids are vaccinated, they can finally start getting back together with friends again. All the slumber parties, birthday parties, field trips, and other get-togethers that our children missed out on over the last year that were so important to their health, to their learning, to their well-being, those are now within reach again if our kids get vaccinated. So that's why, in my estimation, the vaccines are worth it for kids, for adolescents to take. And most importantly, the trials have demonstrated that the vaccines are both effective and very safe in children. That's really what we should want. We've got to keep an eye on that data because, again, we're constantly learning. But the experience with millions of people so far has showed us that the safety profile is strong. And so right now at this point, based on everything we know, it feels like the benefits really do outweigh the risks for adolescents.
And you, Dr. Nguyen, how do you assess the relative risk of the vaccine versus the risk of the disease when you're thinking about it for your children and also other people's children?
Well, it's a great question, Reed. And I first wanted to thank you for convening all of us here today and for your terrific work in the community. I also want to thank Dr. Murthy and really commend you, Vivek, and everyone in the Biden administration. I actually look at where we are right now with more than 50% of adults who are fully vaccinated in the US. If you had told us back in December or January that this is where we would be in May, I don't think any of us would have, that would have been really beyond our wildest imaginations. And actually, I think it's really no coincidence that we have falling rates of infections, hospitalizations, and deaths. It completely is because of the vaccinations that we're doing, or at least a very large component of it is because of the vaccination effort. And so, thank you for that, Dr. Murthy, and to your entire team. I think the question about children, first of all, I agree with everything that Vivek said. We do know that children tend to be much less severely ill than adults, but they do get ill. And I have to say right now, so I have two little kids, Reed, as you mentioned. I have a 1-year-old and a 3.5-year-old. They are obviously not vaccinated. And I have to tell you, my husband and I think about our risk very differently because we have two unvaccinated children. If we as an entire family is vaccinated, for example, we would visit my mother-in-law in South Africa. We would go to many more events that we are now not wanting to go to because those who are unvaccinated, including children, are still at risk. And so my husband and I are still taking a lot of caution. For example, we will go to any outdoor event and any event where everybody else is fully vaccinated. But we're not going to go to crowded indoor settings with a bunch of maskless, unvaccinated people because we don't want to expose our children, but also there is risk potentially from us as well. And so we just are taking a lot of precautions because our children are unvaccinated. So I think that's one component. I think having kids being vaccinated, adolescents, as mentioned, would really give a lot of peace of mind for the family and allow the family unit to make very different types of decisions. Now, one more point, if I may, which is there's a lot of discussion about long-term risk. And when I talk to people who are hesitant about vaccines, they often bring up, well, these vaccines are relatively new. We don't know what risks may happen 20 years down the line. And what about our children and 20 years later and impact on fertility and other things that people may be concerned about. The way that I've been answering this is, look, it's true, right? We cannot possibly tell you for a fact, 100%, that there isn't some kind of long-term effect down the line. How can we possibly prove this negative? At the same time, here's what we do know. We know that for all the other vaccines that exist, all the other vaccines, polio, chickenpox, measles, mumps, rubella, etc., that if we are going to see an adverse effect, we'll see it within 6 weeks. So whatever thought we might have about a risk later on down the line is purely hypothetical. There's no evidence, no scientific or physiological reason why that's the case. And we have to, going back to Vivek's excellent point, we have to weigh that theoretical risk, if there is any, with the very real risk of children becoming ill and the very real lives that we're living, where we have to take many additional precautions because of unvaccinated children.
So let me ask you, Dr. Murthy, and then come back to you, Dr. Nguyen. As what are you going to be looking for in the data as we start to think about now having vaccines eligible for children under 12, now getting down to the age of your children? What are you going to be looking for in the scientific studies and the data that will be coming forward?
Well, Rita, it's a great question. And I'd actually be looking for very similar things that I was looking for in the other clinical trials. Number one, does this work? Is it effective at preventing infection in kids? And second, and equally as important, is it safe? So are there, if there are side effects, are they the kind of temporary side effects like flu-like symptoms, body ache, fever that we see commonly in people get the vaccine but then resolve after a day or two? Or is there something more concerning happening? We want to make sure that these are both safe and effective for our children. And that's what I'm going to be looking at when I think about my kids. And one other thing I just want to say, just going back to Lena's point, which is so important, which is that we all have to think about what we do in terms of where we go, whether we wear masks or not, et cetera, based on our unique circumstances. Like Lena, I have 2 small kids. I have a 4-year-old son and a 3-year-old daughter. And like any parent, like I will do anything in the world to protect them and to shield them from risk. And the thing about being a parent, as so many people listening out there know, is it's not always about the numbers, right? It's if you can take a small risk and reduce it even further for your child, many of us want to do that. And that's one of the reasons why I tell people out there that yes, even though the risks of a bad outcome with your child are low, if you have the option to make that even lower, and to do that in a way that's safe and effective, then why not do that? And so that's kind of how I'm thinking about it. But this also means that people are going to make different decisions about what they do. Some will say, I'm not going to actually go to a crowded place where people are unmasked because I don't know their vaccination status, and I don't want to put somebody at home at risk who may be unvaccinated, like my children. And others may make the decision that they're willing to take that risk. I think the important thing is to recognize that we all have to make our own decision, not to ridicule people for wearing a mask or for not wearing a mask, but just recognize that we've all got to make the decisions that we can to the best of our ability, and ultimately try to be as considerate to others, in that process as well. Like if you're in a circumstance where you're thinking about taking off your mask, check with the other person first that you're with. If you're having, let's say, a get together, indoors or even, wherever it may be, because you just never know what people's circumstances are. They may have somebody at home who's immunocompromised, who may not respond as well to a vaccine. They may have a child at home who's not vaccinated. You just never know people's circumstances. So just a reminder, we've got to be, as we're working through this transition time, trying to get back from COVID time to normal times, we've got to be kind with each other. We've got to be gentle with one another and as understanding as possible.
Dr. Nguyen, your thoughts on this?
Well, I so appreciate Dr. Murthy for so many reasons, but one of them is that he always channels our humanity. And I love what you just said about the compassion that we must have for one another and not making assumptions. I think we are entering this in-between period right now where people are of varying stages of vaccination. Some by choice, some not. As was mentioned, people who are immunocompromised, severely immunocompromised, who are transplant patients or cancer patients on chemotherapy, they may really want to have the full protection of the vaccine, but are not. And we just don't know. We also don't know what people's different risk tolerance is at this point. There are some people who will look at the very low rate of breakthrough infections in fully vaccinated people and say, if that's the case, I want to resume all aspects of my pre-pandemic life. Some others are going to look at those same statistics and say, I don't know what's happening with the variants. I may be living at home with somebody who is immunocompromised or small kids, and I just want to be really careful at this point. And I think we need to embrace all of it and know that we have to get through this period together. But specifically to the question you asked, Reed, about young kids and data about vaccines, I would also be looking, of course, for safety first and foremost, for effectiveness and efficacy, and also keeping in mind that children are not just little adults. And the 12-year-olds that we're studying, the 12-year-olds that we have data for already, and the vaccine is already authorized in this group, they have the same dose of the vaccine as do older individuals, as do adults do. A 12-year-old, if you look at a 12-year-old, has more in common with a 18-year-old than my 1-year-old. And so as we get to younger and younger age groups, it is more complex to do the work because you're also testing dosages. And so I think understanding that this is something that's going to take time, but is really important. And I just will tell you, I cannot wait for my kids at some point, it might be later on in the year or next year, for them to be vaccinated, because I think it'll give a lot more peace of mind. And I really, I hadn't heard, Vivek, you talking about it quite this way in the past, but I'm going to start using this as well, talking about how we as parents want what's best for our kids and being able to reduce a small risk. And in some cases, not such a small risk, but even if it's a small risk, being able to reduce that further. That's what we do for all other childhood vaccinations. I mean, how likely is it that your child today is going to get polio? Not that likely, but we take it to prevent it from happening. And I think we should be thinking about immunizations in that immunizations for COVID-19 the same way that we think about other childhood immunizations as well.
We have 1 minute left before I let you go. And so let me ask both of you. I'll start with you, Dr. Murthy, and then Dr. Nguyen. Just 20 seconds on somebody comes over to your house for this weekend because the neighbors are going to have a barbecue and they come into the house. How do you protect your kids?
Well, it's a great question. You know, if someone is in my house, I would want them to wear a mask. So assuming, of course, I don't know what their vaccination status is, I'd want my child to wear a mask and to stay distanced from them. Because again, you got to protect your kids. And this is a world in which we don't always know what other people's vaccination status is.
And Dr. Nguyen?
Yeah, I just say in general for social interactions right now, when just given that my husband and I are vaccinated, but our kids are not, we will do anything outdoors. Outdoors, very safe. We feel very safe also not wearing masks around others outdoors, even if we don't know their vaccination status. If people are going to be coming into our house, we would ask that they are vaccinated. If we don't know that they're vaccinated, then I would follow exactly what Dr. Murthy said, which is we know that unvaccinated people are still a risk to themselves and to others, and so should still be wearing masks, distancing, and practicing these other guidelines that we've been living with. But just a plea, if you are able to be vaccinated, please do. It helps you, helps others around you, and it helps all of us get back to normal a lot faster.
Well, I want to thank both of you for getting our conversation off to a great start. We're going to be having conversations coming up with many parents and pediatricians from across the ethnic landscape. And so we have a lot to learn, but you really started us off well. Thanks to both of you. Have a wonderful, wonderful rest of your evening.
Thank you so much, Reed. Alina, so good to see you again.
Okay, bye-bye.
Same here too. Thank you, Vivek. Thank you, Reed.